that first trimester, what your body is doing is insane. So you're just trying to exist. So,
Mhm.
yes, get your care, get established. A lot of things are very common in pregnancy and can also be a potential sign that's not quite clear.
Hello, everyone. You're listening to Baby Steps, sponsored by Oxford and Soho Baby, a podcast dedicated to exploring the personal and emotional journeys of parenting. I'm your host. My name is Medea. Today I have Dr. Lincoln, gynecologist. Dr. Lincoln, welcome to the show.
Thanks for having me, Medea. I'm excited to be here.
Of course. Yeah, I'm excited too. Let's get right into it. So, what are the most important things expectant mothers should focus on during each trimester?
Ooh, that's a good question. All right. I think with the first trimester, you're just trying to exist because I tell people the first trimester is a win, lose, or draw when it comes to weight gain, because a lot of times that's what I hear people are really worried about. Like,
Mm,
am I healthy enough? Am I gaining enough? And I'm like, girlfriend, you are just trying to survive because some people, the nausea is like the worst. And I remember with both of my pregnancies in the first trimester, it was so hard because maybe you haven't told people, but you just feel like you have nothing to show for it. You're like, why do I feel like I have the flu? And why do I feel so tired? Like, I don't have an enormous belly. I shouldn't feel this way. So I tell people that first trimester, what your body is doing is insane. So you're just trying to exist. So,
mhm.
yes, get your care, get established, obviously, but like go easy on yourself. Like, don't feel like a horrible person if you are so fatigued and you just don't want to get off the couch. It's fine. I
Mhm.
think second trimester, like live your life, live your best life. Because usually that's when people feel good in pregnancy and they're feeling like themselves again. They can eat, they're not as tired, but you're not in the third trimester yet where you're feeling like, oh my God, will this ever end? So in your second trimester, if you're feeling like you have a new lease on life, go for it. Have all the fun, nest if you want to or don't. If you want to, go on that baby moon trip or whatever, just enjoy it. And then third trimester, kind of circles back like listen to your body. It is really hard in America to be pregnant and then be a new parent because of we don't have paid leave. You're trying to save all your time for when your baby's there. But if you feel like you need to take some time to prepare, to rest, if you're still working and you're 39 weeks pregnant or your due date's tomorrow, please give yourself some grace. And if there's a way that you don't have to do that so that you can rest up and find some peace before the big day, do it, but know that it's okay to ask for help. And if you're feeling like you're expected to work 100%, grow a human 100%, prepare for birth 100%, like it is so hard. So just do the best that you can and know that your baby does not need you to be perfect, just good enough. And this is both when you're pregnant and then after that baby arrives. So, and of course, prepare for pregnancy and read all the things and learn all the things, but choose your sources wisely because there's some really scary stuff out there that's not always accurate. So just be mindful. And if you feel like you're going down a rabbit hole on the internet and you're like, oh my God, like check in with yourself and be like, does this make me feel better or not? And then adjust as needed.
Speaking of sources, are there any that you recommend?
Yeah, so I think my book is a really good source. So this is coming out if you're listening before March 24th. It's called The Birth Book, an OB-GYN's Guide to Demystifying Labor and Delivery. It is the first and only book written by an OB-GYN that just talks about the labor and birth process, like the exit strategy. Um, I wrote it, so I think it's really good, but I think it is a very honest, you know, answer to the questions that I've seen people have all the time, but it's not fear mongering. It's about being prepared. It's about having options. It's about how to get respectful care in a country that doesn't always provide it or where you feel like you have to fight to just get in to see somebody. Um, so I really like that. And then for pregnancy, in terms of books, the American College of OB-GYN has a really nice book. It's Labor and Birth. And what I like about it is that it's nested and it comes from evidence-based sources. Um, yeah, but I know everybody's, you might want to read books, you also want to go online. And I think that whatever you look to, whether it is a Facebook group or TikTok, just know that sometimes what you see out there isn't always evidence-based. And if you're not sure, I think the best strategy, I love it when my patients do this, when they come in and they're like, they show me their phone. They're like, is this true? And we watch the video together. And I'm like, oh my God,
Mhm.
yes, it is true. And let's talk about it. Or no, this is so garbage and please don't. So tell your OB-GYN, your midwife, your family medicine doc what you're seeing. And then we can like help walk you through it and like maybe make you feel better. If you see something, you're like, oh my God, what is this?
Yeah, there's so much contradicting advice, and
Mhm.
everyone has something different to say. It's like, what do I listen to? it's so
Yeah,
overwhelming.
it is. And I think what I find personally irritating is that I have, people send me their stories online and they're like, well, my doctor told me this, but I thought this, my midwife told me that. And even among healthcare providers, sometimes people are still giving out and getting really old, like non-evidence-based advice, um, like bed rest is a good idea. If you're having contractions, like there's no evidence that bed rest works for preterm labor. And if anything, it can make things worse because you're sitting there and your muscle mass is wasting away. Or one I really want your listeners to know about are fetal kick counts. So we usually tell people around 28 weeks, that's when you want to start tracking your baby's movement. And what we usually tell people is you should feel 10 movements in 2 hours. And if you don't feel 10 movements, you should lie down, quiet room, drink some juice, try to really focus. And it's not that that information isn't bad, it's just not enough. And we know that I want you pay if you got 10 movements over three, over 2 hours, but they're not normal, or you just know your baby best. And speaking of resources, there's a really great app. I make no money from it. I'm not affiliated, but it's called Count the Kicks. And what it does, it's an app where you track your baby's movements and then it gets to know your baby's pattern. And it's just a better way of focusing, like individualizing what's normal, what's not. And so if you're like feeling no movement and you're just like, well, I'm just going to wait a few hours and not bother my doctor, my midwife, no, no, please, please come in. We want to know because it can be, if you don't identify things or if we ignore signs, I don't want something bad to happen and then you're second guessing yourself. So I think it is really important to know that sometimes if you hear something and you're like, I don't know if that's quite right or what's going on, it's okay to ask and be like, can you elaborate on that? Can you tell me, is there real evidence behind that? Because I heard this or I heard that. And it's okay to ask.
Yeah. So with the kick, so if there's too little or too many, that's a
That's a great,
problem.
yeah. And so we usually only tell, or what people have traditionally heard is only if it's too little. And really, we know, or we've heard from folks who have had near misses, or um, I have a whole section on my birth or in my book on stillbirth, and I worked very closely with some stillbirth parents who reviewed it and just gave me insight. And I think it's really important to know that even if you're feeling new erratic movement or something that just doesn't feel right and feels like increased activity, again, doesn't mean that something's horribly wrong, but I just want people to know that that could also be a sign. So we want you to come in if there's not enough movement or if there's something that all of a sudden seems very different. And we just want to monitor you and make sure things are okay.
Okay. I didn't know that. That's interesting.
Yeah, I feel like it's one of those things that is not talked about as much. And the reason that I hear, from other doctors is, well, we don't want to scare people. And, a baby can move a lot for no reason. Sure, absolutely. But we know that if there's a big difference between your baby's just a bit more active to like, wow, something is really strange. And if your patient is telling you something doesn't feel right, trust that. And just, I would rather somebody come in and things look great and we send them home as opposed to missing something. And I think that stillbirth is incredibly common. It's 1 in 160, although I think we may have newer data that it happens in 1 in 147 pregnancies, I believe. And this is not to stress out your listeners at all, but it's really been an area that's underfunded, that's not talked about because we don't want to scare people. But just being informed to know what to look out for, I think is really important. And we have to trust women rather than not telling them something because we don't want to scare them. Instead, let's educate them and empower them. So that way, maybe we can get preventable stillbirth rates to as close to zero as possible. Um, I think it's a goal that we should be striving for.
Yeah. And the mother's with the baby 24/7 for 9 months. She's gonna know if
Right.
something's off.
Yeah, yeah. And it's it like my favorite data point. I love this little tidbit. So we know that in folks who've had babies before, when you ask them like the second time or the third time, like, hey, what do you think the size of your baby is? Do you think it's bigger, smaller than your first? Like they are just as accurate when it comes to like ultrasounds in terms of like getting a range. Like, oh, I think this one's bigger. And like you said, because they're carrying the thing around, they know. So like, let's
Hmm.
trust our pregnant folks. Let's listen to them instead of minimizing them and being like, well, drink some juice, call me back and go to sleep. Like, why
Yeah.
are you not paying attention right now? Call me back in the morning. Like that could be catastrophic. Like we need to listen to people.
That's so true. Speaking of, how can women tell the difference between a normal pregnancy symptom and signs of potential complications?
Oh my God. So hard because just like if you Google a symptom, it's either totally normal, Like it's a cold or it's cancer, right? Like it's never, it's everything. And you're like, I don't know. Um,
Hmm.
what I would say is it depends. It depends because a headache, right, could just be a headache or it could be a sign of preeclampsia later in pregnancy. And so a lot of things are very common in pregnancy and can also be a potential sign that's not quite clear. So what I tell folks is if you're not sure and you try whatever it is to reassure yourself and that thing isn't working, call us and let us know. And your office should have somebody who's on call 24/7 who can take calls. And this is great because it can keep you out of the hospital if you talk through it and they know your history as opposed to, having to run right in for that. So an example, like I just mentioned, is headaches. If you have a headache and it gets better with Tylenol, it's probably just a headache. But if you have a headache and it's sticking around and maybe it's like the worst headache you've ever had, or you're seeing spots in front of your vision, or you know that your doc is watching you because your blood pressure has been a little higher, then that could be a sign of preeclampsia. So that's an example where you try some things, it doesn't work out, then we know. But there are lots of things that can be very normal, right? Like a stuffy nose or having some reflux or occasionally leaking urine when you laugh or sneeze. That could all be normal. But if it's happening all the time, it could be that your bag of water is broken. So if you don't know, I'm not saying you can't Google because I Google when I don't know stuff, about I'm like, oh, about this
Hmm.
skin condition. Like, what is that? But if you're not feeling like, oh, this is very obviously okay, call and chat with us and let us know.
Okay, so it really depends. There's no like list of if you
There
see
is
this,
not,
there's a
yeah.
problem.
No, yeah. I mean, because even here's an example, bleeding in pregnancy, if you just had sex and you have a drop of blood, that's what it's from, is that you had sex and you didn't cause any harm. It's fine unless your doctor or midwife said no sex in pregnancy because you have whatever conditions. Um, that's a very different scenario than if nothing has happened and all of a sudden now you have spotting. And so that's why knowing more information it's really important. And yeah, we joke in pregnancy everything could be nothing or something. And we need to know a little bit more about where you are in your pregnancy, what's your history, what else is going on. And once we know that, we can be like, oh, yeah, that's definitely a warning sign. Or, oh, no, that's just, normal, everyday, whatever.
Yeah, this goes back to trusting your gut.
Hmm.
Like, does this feel normal? Does this feel like something's wrong? Just trusting your
Exactly.
intuition.
Exactly. Yeah. I think that we don't put enough on that. And I wish that we would do more because I have had patients who are like, something ain't right. I'm like, well, then you need to come in because I trust you if you tell me something isn't right. And I'm not going to tell you to just, take a Benadryl and go to sleep. Like, no, I would not be able to sleep after telling you that. So yeah, we'd want to see you.
Yeah. How important is mental health during pregnancy, and what can women do to manage anxiety or depression while expecting?
Oh, it is so important. We know that untreated depression and anxiety puts you at higher risks for things like preterm birth, preterm labor, um, other complications of pregnancy. And it's not because you didn't try hard enough or you just didn't think enough happy thoughts. I mean, it's literally when you have depression, anxiety, these are literal chemical changes in your brain and they're affecting you and your body and therefore your baby. And so if you have these issues, we want to know about it because the nice thing about what we call it in pregnancy as well as postpartum, we call them perinatal mental health disorders or perinatal mood disorders, which acknowledges they can start in pregnancy, but they can also start postpartum. When they start in pregnancy, we have really good data to show that treatment makes you feel better, can decrease the risks of all those things I just mentioned, and makes you less likely to have issues postpartum. And treatment might be therapy, it might be medications, and we have really good medications that work and are very safe in pregnancy. This is a really interesting statistic that I don't think many people know, but the number one cause of death in the first year after having a baby um, is related to homicide and death by suicide. And those deaths by suicide are often linked to untreated mental health disorders. And again, I'm not trying to make this episode like a downer episode, but
Mhm.
very common. And we know that a lot of women feel like they can't speak up and they can't say it because you'll think I'm a bad mom. I'm a bad parent because I'm sad. I was trying to get pregnant and now I'm pregnant and you're telling me you should just be happy that you're pregnant. No, it's huge. And we want to get your health optimized in pregnancy so when you have your baby, you can bond with your baby. We know that postpartum depression anxiety is linked with issues in those babies. And a lot of it's because there's just not that attachment and that bonding. And it's not because you don't love them enough. It's because you literally need help with a true medical diagnosis. And when we treat it, we can make those risks go away.
Yeah. Would you say that it's more common to have depression than to not have depression, or
You mean like a baseline or compared to anxiety or just
just
in general?
baseline during
Yeah.
pregnancy and after pregnancy?
Oh, yeah. So I don't have the exact numbers memorized, but we do know that postpartum depression affects about, oh gosh, what is the number? 1 in 6 people, I think.
Oh,
So
wow.
it's not, yeah, it's pretty common. And anxiety, I don't have the numbers, right off my head, off the top of my head. But it's not uncommon. And this is different
Mm.
from the baby blues, which affects about, I want to say 60 to 80%. It's kind of the baby blues are in the first couple of weeks. It's when you'll be fine 1 second, but then you're crying the next. You see this
Mm.
commercial and you're like, oh my God, I can't. And that is related to the hormone fluctuations, sleep deprivation. It is very normal and it goes away on its own, whereas postpartum depression, anxiety tend not to, and can get worse if it's not treated, especially if you're adding sleep deprivation on top of it.
Yeah, that's scary, but it's good to talk about. And it's good to tell people that it's common and it's okay and there's help out there. So
There's so
tell
much good help.
someone.
Yeah, absolutely. And I think that the stigma is getting better because people are talking more. I think even the stigma of like needing a medication for depression or anxiety, pregnant or not, I feel like that's getting better. Um, as we live in these times, people are just talking about it more. And so I hope that it continues to be that way. You're not just weak or you don't love your kid enough. We wouldn't tell somebody with diabetes to just try harder to make insulin, right? Like
True.
I mean, if you do, that's interesting. I mean, there probably are some people out there who say that, but we don't in general. And so you wouldn't tell somebody out there to try harder to make dopamine and serotonin. Like it's based in chemistry. And so I don't care where your serotonin comes from. It's from your brain or it's from a bottle. But if it makes you a better person, makes you feel better, it makes you a better parent, then yeah, we should talk about it.
Yeah. Speaking of depression or postpartum depression, what are the warning signs and how can partners or family members help?
Yeah. So postpartum depression, I heard it described this way once, and now it's how I tell all my patients. I love it. So I'll tell people, before they go home, we'll talk about the baby blues, and then I'll say, it's normal to have a thought like, is my baby breathing? Or am I going to drop my baby? Or are they going to, fall out of the crib or something? It's normal to have that thought pass through your mind and then it goes. But if it's sticky, if you find yourself having sticky thoughts and you can't do things like go to sleep and not watch your baby sleep or leave the room for a second, that is a sign that we could be dealing with something like postpartum anxiety or depression. So if you're having that, if you're having more bad days than good days, because your recovery is going to be bumpy, but overall the trajectory should be towards getting better. But if you feel like it's not, that's a warning sign. And then if you feel like you feel nothing, like you feel completely disconnected to this baby, to your partner, you're feeling just like, you're like, what's wrong with me? That's another sign. And then the really concerning ones, if you're thinking of hurting yourself or hurting someone else, running away or not coming back, those are 911 signs. We want you to come in and, come into the emergency room for sure. Um, but there's no reason to suffer in silence with these other signs. And most people, I mean, it's our standard of care. When you come in for your 6 week visit or even sooner, you'll get a standardized screening. The one that we tend to use is called the Edinburgh Postpartum Depression Scale or the EPDS. But you don't have to wait. You could Google and download the form, and it's a little quiz that you take, and you can even see for yourself and be like, oh, wow, this is not good. I'm scoring really high. I should get some help sooner.
Hmm.
And then you can kind of self-assess before you even come in.
And then how can family members help or partners or friends?
Yeah. So when I'm doing this counseling, like in the hospital before my patient goes home, and if the partner's there, what I say is I say, and just like I'm telling you to the person who gave birth that you can have all these symptoms, you can too, dad or whoever. And so I need you guys to look out for each other. And if you're seeing this in each other, I want you to let us know. And especially with partners, what I tell people is, just not only do we just have a baby, but she's recovering, whether it's from a vaginal birth or a cesarean birth. And so whatever you can do, if you are not the one breastfeeding, you've got those useless nipples, those guys feel like if you're not feeding this baby, you could do other things. You can help with sleep, you can help with changing diapers, but it's a team effort. But if you're noticing something that doesn't feel right, I want you to let me know too, because you're the eyes and the ears on the ground.
Okay, yeah,
And then
because
for
they're gonna
friends
see
and family,
things. Oh, wait, keep going.
yes, they're going to see it. No, you're totally right. And then for friends and families, like actually be helpful. Don't come over just to hold the baby. I mean, sure, hold the baby, But then don't hold the baby, clean the kitchen or
Hmm.
fill the freezer or do the laundry, or even better, just drop off food, knock and run. And like don't even take up time. Like be useful. Don't just come over to
Yes.
see a cute baby and then, expect to be entertained and then, wonder why she doesn't seem so excited to see you. Like actually.
Yeah, this is a new mother. She has all these new responsibilities. She's not gonna have
Yeah,
time to
yeah. And
entertain
she's wearing a
people.
diaper too, right? Like she's
Yeah.
bleeding and whatever. Like hello, like please help a girl out. The human just came out of her. Like let her nap, let her sleep, let her shower, do all the things for her.
Hmm. Final question. What
Mhm.
advice would you give to mothers listening right now?
Okay, I have to say the first one because I really do believe it. It's not just because I'm here, but I really do. If you want a really good source of information for labor and birth, I would highly recommend my book, which is, coming up, but is also an audiobook that I narrated. It was a lot of fun getting to read my words out loud. And, there were a lot of burps and things that we had to stop for and we re-recorded. But I'm saying this because I really put my heart and soul and I really took so many questions that people were asking me constantly. And I want you to show up prepared because when you know what could happen, then it's not as likely to be scary. I don't know about you, but like, I mean, we're in the generation where we don't just go out to eat. We like Google Street View to see what the parking is, right? Like we don't like surprises. I want to know what the
Hmm.
menu is. I want to know what it looks like inside. Like same thing with your birth. When something's happening with your vagina, like it would be nice to know what's happening. So
Hmm.
do that, prepare. And then I think just know that have a plan. I think that having a birth plan or birth preferences, and I have an example in my book, I think it can be a good thing. And sometimes they get a bad rap. But I think it's really great to think through what matters to you because it's different for every different person and talk about it with your provider ahead of time to see if they vibe with that. And if they're like, oh, yeah, this sounds good. And know that sometimes plans can change and just be open to knowing if this is your first time having a baby, you might think you want this thing, but then something changes and now you want that. And that's okay. Don't feel guilty. Parenting is all about making it up as you go along. And you might change your mind or be like, oh, this is working. This isn't working. Same thing with having a baby. And so go easy on yourself and know that you don't need to be perfect. Preparation is awesome. But don't feel like, you have to know everything. Have a provider who you feel like you can ask questions for and you feel empowered. Um, and bring a good birth playlist. We love a good playlist. So think about that.
Yes. That's amazing. That is all we have for today. Dr. Lincoln, thank you so much for coming on. Listeners, thank you for tuning in. You've been listening to Baby Steps, sponsored by Oxford and Soho Baby. Have a great rest of your day, everyone.
You've been listening to Baby Steps, sponsored by Oxford and Soho Baby. If you're in the market for a new crib, glider, dresser, or more, we'd love for you to check out our line of furniture. Head over to oxfordbabyandkids.com or sohobaby.com. All links are within the show notes. For more information as a listener, enter the code PODCAST10 for 10% off your total purchase, plus free shipping on all orders over $799. Thanks for listening and tune into our next episode. Bye for now, and remember, every step is a step towards progress. We hope today's story gives you the confidence and the assurance that every journey is different, but we do it together.